Well, here we are at another edition of the Ben and Gary Show, and we know dentistry. And we got a question that came up recently that was on the subject of why a veneer or why do you do a crown? So essentially, why would you even need a crown if you're going to do a veneer? So there were questions about that. So I guess maybe we should start with, it sort of depends on the kind of what's going on with the tooth in the first place, and what's the condition of the tooth. And maybe we should also understand maybe what the difference is between a veneer and a crown.
Right.
A veneer, also known as a laminate, is really a front covering, a facade for a tooth that is made out of ceramics or porcelain. And they actually, of course, are made out of composite, but the ones that we are probably comparing to a crown would be a porcelain veneer. And those are really just coverings for the front of a tooth that can mask what it used to look like, and to make an improved appearance, and just have a great look in the end. They're very durable and can last very, very many years. However, depending on the type of or the condition that the tooth is in, it may not be the right support for a veneer, and that's when you really have to go to a crown.
Right.
Crown is really just think of it as better known as a cap on a tooth, and we refer to those as crowns. They can be made out of different materials, but the sort of most common materials that they're made out of now are ceramics or zirconia. There's another one also called Emax, which is a lithium disilicate type of restoration that can be made to look very lifelike and very durable. And they have different varying levels of durability. But I guess, really, maybe we should talk about why a veneer wouldn't really work in some situations. Gary, you want to kind of address that in some sort of way?
There's situations where there may be a lot of fillings in the front tooth, and of course that would not provide us a very durable substrate for the veneer to attach to. Also, when teeth have very dark shades, the shade would shine through the veneer and alter you wouldn't get the aesthetic results that you really are looking for, especially if you want to lighten your teeth. So those are some issues. The other issues that come into play are excessive bite forces. If you have a very deep overbite and you like to go into a protrusive or a situation where your lower jaw would be further ahead of your front teeth, then those are situations where you just have a lot of bite forces that come into play and would cause fractures of the veneer. So it's just it depends on also the amount of enamel that is still present. So
veneers really bond best onto enamel versus the inner part of the tooth.
Right.
And most often we can't really get away with not taking away some sort of level of enamel on the tooth, but to be able to attach the veneer first. People are also talking about, well, do you have to really buzz down my tooth in order to get a veneer? And the answer is no. But if you want that veneer to not add too much thickness to your tooth, you'd want to take away some of the enamel to be able to add back a better surface on the front of that one. If you simply place the veneer on top, then you have often to be very thick and bulky restorations, and they are, in our opinions, failures in that respect. But to your point about the excessive forces, we have these patients who have different habits. There are people who bite their nails. They just can't stop these sort of neurotic sort of habits of like pen biting, and they often aren't even aware that they're doing them. So if that is what you do and you can't change it, then I would have to say that you're going to have to use something that's far more durable. But at the end of the day, you really shouldn't be doing those things because they're not good for your teeth. They're certainly not good for your veneers or your crowns. But if you have high forces and you have teeth that are really worn down because of how much force you place on them, then I'd say the veneer is going to be difficult to keep it on. It's probably going to have the same effect that your enamel had, which is going to get worn down, chipped, or broken. So we go to something that's far more durable, a full crown that's going to cover over top of it. You think of it as a thimble that might be in your thumb. Essentially, that little hat or that little thimble that might be on there, it's the same thing as a crown versus a veneer. It's kind of like you're pressing on nails on those fingers, and it's like, well, how long is that going to last? Well, probably not as long as a crown will. I guess another thing too is that sometimes teeth are just too dark for a veneer.
Right.
And
so we have to be able to hide that dark substrate of the tooth structure. So we'll use zirconium crowns, which block out the dark substrate, and then that gives our ceramics the ability to then bring the shade value up to whatever the patient really desires. So it's gives the ceramics and us, much more flexibility as far as that shade.
Yeah, we always want to be conservative, so veneers are great, but if you're going to be conservative, but you cannot really fully change the look of the tooth, then the veneer is not the answer. You can't achieve the right look with something as conservative as a veneer. One of the things that is critical about a veneer, and it's wonderful about a veneer, is that there is some level of light that passes through or transluces through the veneer, which allows, when you place the veneer on the tooth, whatever's behind it might actually show through, and you can't block it out as much, which is another reason why veneer is not indicated in a situation like that. And if you have a crown that's going to mask it even better, then that's really the answer.
Right. Yeah, sometimes the tooth position is also comes into play. So there are situations where there's a little bit of malalignment, and we can correct that with a crown better than with a veneer. And so it gives us more freedom. Also, if there's spaces in between the teeth, crown's sometimes better to close those spaces. We can have that profile of the tooth much more, so that it looks much more natural as it comes out of the gum tissue. So those are just some of the variables that we have to consider when we consider a crown versus a veneer.
I've actually had a lot of cases, I'm sure you have as well, where patients might have come in with a veneer that just doesn't stay on very well, and they are frustrated by the fact that happens. And when it comes to what we find out is that when that veneer is off, you get a chance to evaluate what the tooth is like. Back on that same subject is well, what's the condition of the tooth? Or if there's not enough enamel on the tooth because the individual already had it shaved off, but yet they only have a veneer and expecting the cement or the bonding material there to be able to keep it on. Well, the inner part of the tooth doesn't really bond as well, not for as long, and it's not as predictable. So therefore, you have to move to a crown that's going to stay in place far better. So even if you've already had them and they haven't really done correctly, then often really have no other recourse but to go to a crown. We usually like to start with a veneer if we can, because it is more conservative.
Right.
You can't really go back from, once it's a crown, it's always going to be a crown. You can't make a crown into a veneer, so you've really lost that opportunity to be conservative. But sometimes there's just no other way to be able to do it, and the crown is what's necessary. And if you want something that's going to be long-lasting for hopefully decades to come, well, either vehicle can get you there, but it's about what's it sitting on, what is the tooth condition prior to the veneer or the crown.
Right.
And our goal is simply going to be, how can we create the best, most outstanding looking restoration to be able to have it for the longest period of time. And whether it's going to be veneer or crown, it's up to the dentist to be able to make the right decision, and so that you can use our expertise to be able to have the kind of result that you want.
Right. So that's
latest edition of the Ben and Gary Show.
That's it in a nutshell.
We know dentistry. Give us your questions, and we look forward to hearing from you in the future.
Great.